Now, the World Health Organization is hoping an international vaccination campaign will stop outbreaks of Mpox in Africa within 6 months. The UN agency's first shipment of vaccines is due to arrive in the Democratic Republic of Congo in the next few days.
Mpox is an infectious disease that can be spread between people and animals. The virus hits children the hardest. In the current outbreak, 60% of cases are in those aged under 15. Mortality rates can be up to 10%. Symptoms of Mpox include a rash with blisters or pimples on the face, the hands or around the genitals and mouth. The disease can also cause swollen lymph glands and flu-like symptoms such as a headache and fever. Symptoms usually begin within a week of exposure. Most people recover within 14 to 28 days, during which time they're still infectious. That's quite a long time to be infectious for. Those with a weakened immune system may take longer to recover.
If people are discharged home while they still have a rash, then it is very important that they stay isolated from other members of the household and use their own specific towels, bedding, and eating utensils.
Anyone infected with Mpox should first tell a healthcare worker or doctor, stay at home and follow the latest medical advice.
There are not any specific drugs or treatments that are available for Mpox. The most important thing is good, supportive nursing care.
Care involves good hydration, nutrition and painkillers. But it is possible to try and avoid getting Mpox in the first place. Infection spreads through direct skin-to-skin contact, including hugging, kissing or having sex with an infected person. Rodents, like rats, can also host and transmit the virus. Animals hunted for bushmeat, such as monkeys, can too. Avoiding close contact with other people in crowded places such as discos will similarly help to prevent infection. Previous smallpox infections and vaccines can also offer protection. That's because the two poxes are part of the same virus family. Some countries have access to vaccines originally designed for smallpox.
They do appear to be very effective. The best is to have 2 doses of the vaccine a few weeks apart to increase protection. But I think in an epidemic setting, the most important thing is to get as many people vaccinated as possible. And so I think 1 dose will offer you pretty good protection as well.
Getting immunised soon after a known infection is also advised. It should help to stop the infection developing.
Rosamund Lewis leads the World Health Organization's response to the Mpox outbreak and joins us now from Geneva. Pleasure having you on the programme. Now, we know that Mpox vaccines are available, so tell us why the World Health Organization is so concerned about this latest outbreak.
This latest outbreak is concerning for a couple of reasons. There have been many cases and outbreaks of Mpox in Central Africa for many years, but the number of cases reported has continued to rise significantly since 2022 and reaching high numbers this year, with more than 20,000 cases already reported this year in the Democratic Republic of the Congo alone. As part of that outbreak in that country, there has also been a new strain of the virus, monkeypox virus, identified, which is spreading between people exclusively with no link to animal to human spread. And so that spread in the eastern part of the country and that sub-region is concerning because it is passing exclusively from person to person. It has been doing so now for some time, since last September, and is now increasingly being found in neighbouring countries as well.
We heard in the report that we just saw that health organisations are concerned about a possible lack of vaccinations. What is the problem there?
So vaccines are available, have been used in many countries over the last 2 years, 2.5 years during the global outbreak of Mpox, which began in 2022. And WHO has now triggered the process towards an emergency use listing of these vaccines so that they can be more easily procured, not only by countries directly, but also by other agencies such as United Nations agencies like UNICEF or the Global Alliance for Vaccines and Immunization, Gavi, who can procure vaccines on larger quantities if they have a WHO emergency use listing or pre-qualification. So WHO has now triggered that process, and those vaccines are being reviewed, and that will make them more broadly available. In the meantime, the Democratic Republic of the Congo and Nigeria are two countries that have in fact approved one or two vaccines, respectively, one in Nigeria, two in the Democratic Republic of the Congo. And so at the moment, in the interim, WHO is also coordinating with other partners to secure donations of vaccines from countries that may have some reserves left over from the global outbreak, which is ongoing. And so they may want to continue to offer vaccine to their populations. But right now, the greatest need is in Central and East Africa, where this disease is in fact spreading.
Mm-hmm. We've had the experience of COVID. That got us talking about getting vaccines manufactured in Africa. Are we getting closer to the day that an Mpox vaccine can be produced in an African nation?
So that is also under discussion. These vaccines are very similar to smallpox vaccines, which were successfully used to eradicate smallpox. And in fact, many countries produced their smallpox vaccines back in the day. So it is something that is under discussion as well. These newer vaccines, which are very similar, but also designed to be safer. There's possibility to discuss manufacturing of these in other locations, as well as other vaccines that are currently under development. There may be other possibilities for sharing manufacturing capacity also for future vaccines.
Rosamund Lewis from the World Health Organization. Rosamund, thank you so much for your time today.
You're welcome. Thank you.